Hello, my name is Dr. Robert Cordero, and I would like to review with you the important features of glaucoma. This model of the eye shows how light rays are transmitted through the clear part of the eye, the cornea, the pupil or shutter of the eye, the lens, then stimulates the rods and cones of the retina into electrical energy and nerve impulses, which then travels through the optic nerve, fibers and tracts to the back of the brain for final visualization and interpretation. Often we are asked, what is glaucoma? Glaucoma is a disease of the optic nerve, that part of the eye which carries the images we see to the brain. The optic nerve is made up of 1 million individual fibers and is like an electrical cable wrapped with insulation. When damage occurs, blind spots develop, and if not appropriately treated or undetected, it can lead to irreversible side vision loss and blindness. Often we are asked, what causes glaucoma? There is a clear liquid called the aqueous humor which circulates inside the front anterior chamber of the eye. To maintain a healthy level of pressure within the eye, a small amount of this fluid is produced, roughly 1 cc a day. Throughout the day, an equal amount flows out through a microscopic sieve-like drainage system called the trabecular meshwork, which is located near the white margin of the eye. Since the eye is a closed system, changes caused by age, disease, or trauma leads to the breakdown of collagen, elastin, and protein with eventual blockage and clogging of this delicate drainage system. Fluid pressure builds up along with loss of oxygen and blood flow can lead to cell death of the optic nerve fibers. There are various types of glaucoma. At least 90% of the cases occur with what is known as primary glaucoma. In the United States, this is the open angle type. This often affects both eyes, is slow in development, and has no symptoms until nerve damage and blind spots occur. A skilled eye care physician should measure intraocular pressure with a tonometer, inspect the drainage angle by gonioscopy, assess the health and integrity of the optic nerve by ophthalmoscopy and computer ultrasound, review the peripheral field of each eye by visual field testing, then finally assess all of the past and present findings to determine the best treatment plan with you. What are the risk factors for developing glaucoma? One is increasing age over 40 years. 2 is elevated intraocular pressure above 22 millimeters of mercury, the normal being between 15 and 19. A family history of glaucoma. Ethnicity, in particular African and Hispanic ancestry. Nearsightedness. Patients with thin corneas as measured by pachymetry. A large central cup disc ratio, and other coexisting diseases such as diabetes, migraine headaches, and poor circulation. There are several treatment options. Patients are often treated for glaucoma when evidence of disease occurs, progresses, or the probability and risk factors for development are high. Various forms of treatment exist, such as eye drops to lower intraocular pressure by decreasing the production and/or increasing outflow of the drainage system. In some cases, oral tablets can act like diuretics, will reduce the amount of eye fluid that is produced. Laser surgery, known as SLT or selective laser trabeculoplasty, is done in the office and will use light energy to enlarge the openings and pores of the drainage system. There's also surgery done in an operating room under light sedation to create a bypass or artificial channel for the eye's fluid to drain. Sometimes one method alone is not effective nor sufficient to control intraocular pressure, and various combinations are needed to limit optic nerve damage. In summary, it is very important for patients with glaucoma to get periodic visits, at least every 4 to 6 months, with an annual visual field and optic nerve analysis. The monitoring of intraocular pressure and the management with medications and surgery are the key to the prevention and progression of glaucoma. It is important to tell us about changes in vision, like blurriness or problems related to drops like breathing, redness, stinging, or itching. There are a variety of treatment methods we can use to fit your lifestyle, budget, and insurance coverage. With our joint efforts, we can often control and prevent future vision loss. Thank you for listening. If you have any questions, please ask our certified staff or your ophthalmologist.